This is the committee.
Good morning. This is the Committee on Healthcare. It is March 29th, maybe Wednesday. Is it Wednesday? I think it's Wednesday. It's Wednesday. And we have a couple things going on. First, I'm going to tell you of some changes. We will not yet hear, we were supposed to hear the Ways and Means Amendment on our Psych Pack Compact at 10:30. There's an issue with Representative Andrews' schedule, so we're going to fit that in at some point. So instead, once we're done with this testimony, we'll take a break, and then we are going to walk through, hopefully, fairly easily, what we recommended in the budget, and then where you can find it in the budget documents. Because I know for a lot of new people, I know I actually just really recently figured out how to read the budget. It's really cumbersome to find everything. So we'll do that. You don't have to say if you don't want to, but it'll be something we do just to make sure everyone's prepared for the conversation on the floor Thursday and Friday. Now we're going to move to S54. So S54 is an act relating to individual and small group insurance markets. We're going to have Ameren walk through the bill, and then we're going to have the Deputy Commissioner of DEVA, Addie Stromolo, and the Deputy Commissioner of DFR, Emily Brown, who are here with us, in whatever order they choose, give us kind of an overview of the situation and what we're trying to solve for here, and then we'll hear some witnesses and what they think of the legislation. So this is something we did last year. Some of you may remember, where we unmerged our markets in order to allow for subsidies to come from the federal government. We need to continue to keep the markets unmerged to continue to receive those subsidies. And then eventually we will need to address what happens with our merging or unmerging of markets should those subsidies run out, or not run out, but stop. So anyway, we're going to let Ameren go through the language. It's on our committee page, and then we'll go from there. So it's going to be a little education and then witness testimony. And we have Mari and Brian on the line today. Ameren, we can't hear you.
You can't hear me?
Maybe it's me.
It's very muted.
Very muted.
It's not our thing.
Turn up your computer.
Is there volume?
Not like a computer.
Hopper's going to fix everything.
No, that's been read for a while.
But we turned this one up. Did you turn yours up? We'll try again. Maybe we.
Talking about the remote for the TV.
Okay, trying again.
Perfect.
There you go.
Oh, okay. Not
Yeah.
on mine then. Okay, great.
Yep.
All right, start again. For the record, Ameren Aberdeen Legislative Council. I'm going to share my screen so that you can see S54 as passed by the Senate. And can you see that now?
Yes.
S54 is an act relating to individual and small group insurance markets. Section 1, individual and small group health insurance markets, Green Mountain Care Board. Subsection A, as used in this section, the health benefit plan, registered carrier, and small employer have the same meanings as in Title 33, Section 1811. Subsection B, notwithstanding any provision of Title 33, Section 1811 to the contrary, for plan years 2024 and 2025, a registered carrier shall, 1, offer separate health benefit plans to individuals and families in the individual market and to small employers in the small group market. 2, apply community rating in accordance with Title 33, Section 1811F to determine the premiums for the carrier's plan years 2024 and 2025 individual market plans separately from the premiums for its small group market plans. And 3, file premium rates with the Green Mountain Care Board pursuant to Title 8, Section 4062 separately for the carrier's individual market and small group market plans. Section 2, the effective date of this act is on passage. And that's all.
Easy peasy, right? Any questions? I know there's probably a lot of language in here we don't recognize, but are there any questions in general about the bill?
I thought that the plan year 2024 was already established because it has this long runway. So I was just confused about those dates.
Cameron?
I think you'll probably hear more from that from the Department of Vermont Health Access and DFR. It's true that there are many of the steps for plan year 2024 have already taken place or are taking place. Having said that, the current plan year 2023, as the chair mentioned, has had this separation between the two markets. And there is an awareness that this bill has been out here for several months. So you may hear how the carriers and the Department of Vermont Health Access have planned for this contingency.
Great. Any other questions for Amron?
Yeah.
Tapper?
Could you please explain in words that I might be able to understand?
What this bill is doing? You mean?
Number 2.
The
B2.
apply community rating.
Okay. So presently, you may recall back to our Insurance 101 discussion towards the beginning of the session that Vermont applies community rating to its, not currently for plan year 2023, but previously for the small group, which is employers who have not more than 100 employees in a year on average, as well as individuals and families. All of those insurance plans are, the rates for those are calculated based on the experience of all of the individuals who have been participating in those plans over time. There's a lot more technical stuff that goes into how they evaluate that experience in order to make rates. But the point being that you have a set group pool of people that you're using to determine the experience rate for setting insurance premiums. Previously, prior to plan year 2023, you had all of the small group employer individuals, and then all of the individuals and families. All of those people were being used to look at the rating and the experience of that group. 2, what we're saying in 2 right now is that you're going to look at the community, or the pool that you're now looking at is separated. So individuals and families will be evaluated in one hand, and then the small group people will be evaluated in the other hand. So you're creating 2 different pools of people that you're using community rating for.
Thank you.
Thank you, Amron. Art?
I'm trying to remember. I know one would lower the premium, the other would raise, and
Right.
I want to remember which was which.
So we'll hear more, but small business went down, individuals went up, and individuals get the subsidy when they're buying on the exchange.
Okay, all right.
Did I said that right?
And that corrects when they're all in the middle, so it saves money for the small business.
Saves money for the small business.
Gotcha.
Yep. Great. All right. I think the questions are rearing into
All right.
not the language. So thank you, Amron. And are you coming up together?
Is that okay?
Yeah, absolutely. Let's get you a chair. Thank you. Sorry, I should have done that before we started.
Thank you.
It's talking. Thank you. All right, I'm gonna make it your role from now on. It's okay.
Oh, it's okay.
And are you?
It's over at the same.
Yeah, exactly.
Okay, good morning, everyone. For the record, Addie Strumolo, Deputy Commissioner of the Department of Vermont Health Access. Nice to see you all.
Yeah, and my name is Emily Brown. I'm the Deputy Commissioner of Insurance at DFR, Department of Financial Regulation.
And I think we're gonna do introductions.
Oh, cool, okay.
I know you, I'm not sure, we have a new member, so let's do that real quick. So Art, start with you.
Finally, good to see you
Good to
again.
see you.
Wow, that's incredible. Art Peterson, State Rep, Clarendon, Wallingford, West Rutland, Rutland Town.
Yeah, ditto. Leslie Goldman, Bellas Falls area.
Daisy Brebeco, and I represent Winooski.
I'm Topper McFarland, I represent Barrytown and a small part of Williamstown.
Lori Houghton, City of Essex Junction.
Alyssa Black, Essex.
Alan DeMar, represent Enosburg and Montgomery.
Melanie Carpenter, it's my day 6. I represent Hyde Park, Belvedere, Johnson, and Woken.
I'm Bobby Farley Rubio. I represent Barnet, Reigate, and Waterford.
And you both know Brian Sheena and Mari Cordes. They're in Zoom land somewhere. So great. All right, I'm going to turn it over to you.
Okay, great. Thank you. I'll start off. We're going to kind of go back and forth here. So this bill, S54, originates from a legislative report that Emily and I authored based on some work that we did with a working group. I think every witness today participated in that working group last summer about the structure of the insurance markets and how that impacts affordability for Vermonters. I thought it would be helpful to just kind of level set what we're talking about when we talk about the individual and small group markets. We're talking about 70,000 covered lives in Vermont. So you all have heard me come in and talk about Medicaid when we're talking about, more than 200,000 Vermonters. This is really a smaller slice. And of that 70,000, about 26,000 are enrolled in a qualified health plan through the health insurance marketplace known as Vermont Health Connect, which is administered by DEVA. And these are the folks that are eligible for subsidies. The remaining 50,000 are directly enrolled in qualified health plans through QHP issuers, so MVP and Blue Cross and Blue Shield.
Can you say what QHP is?
Qualified health plan, yep. And this is the group where the subsidies are not available when you're directly enrolled. So that's just context for what we're talking about when we're talking about the markets being merged or unmerged. So I think Emily's going to talk a little bit about the structural piece of that, and then I'll talk about how it relates to the subsidies, and we can go from there.
Yeah. Can I ask a question real quick? And I'm sorry, but
Sure.
I'm surprised at the number of 50,000 that are directly enrolled.
So primarily that's small employers.
Okay, gotcha. Okay,
Small group.
Thank you.
The report that you were referring to, is that the 2019 report of health insurance of merged markets?
I think that's a
More recent.
previous
That's an
one.
older
Yeah,
one,
this
yeah.
one was from Act 137, and we released it in January of this year.
Okay,
Claire,
thank
can
you.
you find that and put it on post it on our page today?
And that'll be helpful because it just provides some more context about the discussions we had this summer.
And I apologize. I meant all day yesterday to send that to everyone. And in the 7 hours on the floor, I didn't get to it. Apologize. Go ahead.
All right, so for the record, Emily Brown, DFR. So I'll be talking a little bit about the structure of the market we're talking about. So at the inception of the Affordable Care Act, each state had the opportunity to decide whether they wanted to have a merged market, which means that your individuals would be combined with your small groups into one, as Amarin said earlier, into one community rated pool. Or states could decide to have separate pools. So have your individuals rated separately from your small groups, from your small employers. And at that time, Vermont made the policy decision to combine those two groups together. The rule of large numbers, the more you have together, the more stability in rates, and also meaning that the risk would be spread over a larger amount of people. Was it 2019 or 2020, the ARPA?
2021.
2021, during the pandemic, there was a federal law that passed which essentially increased subsidies for the individuals who were enrolled in qualified health plans, QHPs. And what this did is it provided Vermont an opportunity to look at our market and say, is there a way to do this? We can make these plans more affordable for small groups, small employers, but also largely protect the individuals, right? So as I talked about, we had made the decision to combine our markets. And when you split those markets apart, naturally the individuals usually have higher claims experience, have higher cost than the small groups. So then you have kind of a unequal balance. You have the small groups costing less, lower premiums, and then the individuals having higher premiums due to their experience, their claims experience. So what the subsidies did in 2021 is actually increase subsidies for individuals so that when we split the market apart, they would be protected largely from those rate increases that were happening because of the split of the market. So that decision was made. The process involved the Vermont legislature, but also we had to approach the federal government to request that market change. And we did, DFR in conjunction with DIVA did that, and it was approved. And then there was a little bit of uncertainty early, kind of early last year about whether the subsidies were going to be continued, right? Because if they weren't, then those in the individual market would then have seen their premiums increase because they wouldn't be protected by those subsidies anymore. So when, I think it was during our working group during the summer, that news came out that the subsidies were going to be continued. And so this bill largely reflects that decision and maintains the current market structure, which is the small groups being rated in one pool, the individuals being rated in another pool, and continues that till the future up to plan years 24 and 25, which is what we know now about when the subsidies will be extended to. So we don't know what will happen after plan year 25, but right now we do know that the subsidies will be available for the individuals and will essentially protect them from those, potentially higher premiums. So that's really kind of at a high level where we are now. And I can take questions, or I don't know if we can.
Can you explain the plan years? So
Yes.
how the whole, not how the whole process works, how the process works in the timeline piece of it?
Yeah.
Do you want me to take that?
Yeah, why don't you take that?
So there, in general, with the health insurance marketplace, we want to be planning a year or so ahead of time because we have basically a year-long process to develop the qualified health plans, the design of the qualified health plans each year. So for example, this year, the 2024 plans are fully designed. So we don't want to be making changes to 2024. We want to be talking about 2025. With respect to the market structure, it's a little bit different because, as Emily described, there's a federal process that needs to happen if we're making changes to the market structure. So if we were going to be talking about re-merging the market, we would need to be talking about 2025. But because we're maintaining the status quo, we don't have that same time constraint.
Thank you. Yeah.
And based on, for timing purposes, when do we have to start looking at this again? Knowing right now, if everything stays consistent, that this is stopping in plan year 2025.
Yeah, we've talked about this.
Yeah.
We think next session is really going to be the time when we want to dig in on other potential affordability strategies in the event that this cliff does come to fruition in 2026. It's possible things could change on the federal level, but I think where we all are now in terms of this recommendation is that as long as those enhanced subsidies are in place, we think the markets should remain separate for all the reasons Emily described. But if the enhanced subsidies are going away, we need to talk about other strategies around affordability.
Questions? Great. All right. Great job. Thank you. All right. Mike?
Unless you want the badge.
No worries.
Yeah, of course.
We made this small. Good morning, Mike Fisher, healthcare advocate. It struck me as I listened to this that it made sense to back up the clock just a little bit more to understand this decision that's in front of you. I honestly can't remember. I think it was in 2011 in Act 48 that we had the original conversation about how to shape the markets, the individual and the small group markets. And that was a time when we didn't have consensus around this room about what to do. I sat in a different place at this table or the table across the hall. But we were motivated because the individual group was in serious trouble. There's this great term in healthcare called death spiral. When prices go up, when premiums go up, who leaves the insurance market first? People who need less care. People who need a lot of care, hey, they'll keep paying premiums that stretch them. And so you end up with a cycle of sicker and sicker pool and healthier people fleeing that pool because they just can't afford it. And can't afford it and because they're not as motivated to pay the premium. And so we believed that the individual market was in that kind of a crisis. And so that was the motivation. That was part of the motivation. In addition to what I think it was Emily who just said, broader pool, more stable, those, both that sort of the math side of that and also the value side of that. Insurance sort of by its nature is about sharing risk. It is sort of by definition, everybody pays in, healthy people pay in and don't use a lot of services. And people who are less healthy get the advantage of getting coverage without being bankrupt. So that was our motivation in 2011. In 2011. So in 21, when we saw at the HCA, when we saw the real value of the enhanced premium tax credits, the enhanced premium tax credits are real. They're a big deal. They solved, there were some serious problems with the subsidies in the Affordable Care Act before that. The cliff was mentioned, the cliff at $4,000, at 4,400% of the federal poverty level. There were dynamics there where people could earn $1 more and lose $11,000 in tax credits. Bad cliff. That's gone for now. And so we at the HCA looked at it, and a little shameless self-promotion. We looked at it and we thought, hey, the individual group is protected in a way like we've never seen before. It doesn't make sense to continue to merge the markets. Or maybe I should say, because this was uneasy for me, we asked the question, does it make sense? We should look at this and see whether it makes sense. And hey, we reached out to Blue Cross and we reached out to the chamber and formed a very quick coalition because honestly, I was moving over to their side, but that given the enhanced premium tax credits, it really didn't make sense to continue to merge the markets. So that's what happened. For the rest is sort of the history that's been repeated to you. We remain in the exact same place with the enhanced tax credits. The individual market is protected, and that it makes perfect sense to continue this unmerged for the additional 2 years, 23 and 24.
Yeah, 24 and 25.
24 and 25. I think I agree with your previous witnesses that it makes sense to look at that again next year. I am very fearful of that. I no longer, there's this sort of this political logic that once a benefit is given, it's unlikely to be ungiven. I don't buy that anymore. I think there are major political voices in our country today that are happy to take away major benefits and have no prediction to you who will be in the majority in each of our legislative bodies after the next election. So that, I think that's a real risk, but it's a few years away. And then my last thing to say is there's a lot more details behind the curtain here that doesn't make sense to go into here. My team spends a lot of time. We put a lot of resources from the Healthcare Advocates Office into insurance rating issues. We're gearing up right now for the insurance rate review process. If you as a member feel good about having the surface scratched and think this is not a world for me, then perfect. If you ever want to take a deeper dive, I love talking about this stuff.
Bless you. Any questions for Mike?
Do you think it had the intended effect that we thought it would?
Yes, of course. The estimation was $17 million in benefit for the small group. I don't have an exact measure of that number, though we did see the rates last year, the differential rates between individual and small group. And nor could I repeat for you, but we could get the numbers of premium tax credits that are coming to Vermonters before and after this change. So I think it's measurable, and I think the answer is yes, it did have the effect that we thought it would have.
Do you happen to know what the rates that went, like how much did the individual market on average go up and how much did the small group go
I
up?
couldn't get it from memory, but could get it
It
very
was a differential.
quickly. Yeah.
Art?
When we did that 2 years ago, did that kick in automatically to the individual market? Does the individual have to do anything to? No. Okay.
No, this is,
Yes.
well,
I mean, if they're buying on the exchange, they have to click the little button that says, I want to see if I can get financial assistance. And they have to be buying on the individual market. They can't buy directly through one of the carriers.
correct. You're right. For those people who are already on the exchange and already getting premium tax credit, it just happened behind the scenes.
That's what I mean. The people who are already there.
Yes.
There was and is a substantial group who needed to take some action, and that is individuals who are buying directly from the carrier. I don't know the most recent number. Last I heard it was 5,000-ish people who fit that category. Now, some of them, and so they needed to take some action. They needed to shop. They needed to understand how the premium tax credits affected them. And so, hey, we don't know much about those people. Some of them might be substantially higher income and they've looked at it and they've decided it doesn't work for them.
Okay.
I'm convinced a lot of them are leaving money on the table.
Yeah.
And there's been real efforts by the carriers and by other, and by DEVA, I think, to reach out to that group of people. Nobody likes to shop for health insurance. Even when somebody like me gets on the radio and says, yay, it's open enrollment, nobody likes it.
I just want to, people might be listening, I want to clarify, and correct me if I'm wrong. If you're buying direct through one of the carriers today, through a QHP, and you want to move to the exchange in order to potentially draw down some subsidies to help you, it's the same plans, correct?
Yes.
So whatever you're buying over here through a QHP, you can get over here with potential subsidies. So anyone listening, I
And
would suggest, in the coming year, you look at that.
correct me if I'm wrong, there's no open enrollment dynamic for that.
That's correct.
That's good. So
So you don't even have to wait till November. People can start looking at that now. So talk to your constituents, and put some messaging out there. It's really important that people who are buying, direct from QHPs and the carriers,
direct from the carrier, direct from Blue Cross or MVP.
right, to work for a QHP, that they're fine with them moving over in order to do this. So.
So prior to all of that stuff happening, what was the percent of poverty level that people would be in? I thought I heard you say it went up to 400%.
So before the change in the premium tax credits, the federal subsidies capped out at 400% of the federal poverty level.
So before, okay.
Now it is applied more as a percentage of income that goes significantly higher. So if you're, I'm not sure I'm gonna be able to say it right. If your premium is more than 8.5% of your income, you get, Addie is shaking her head, Addie, you get some premium tax credit.
More than 8%.
Patty, do you want to add to that?
Yeah,
Yeah,
so
that'd be good.
basically, what the enhanced subsidies are is that they cap the amount that you are required to pay toward a certain qualified health plan at 8.5% of your income. That's why when the cost of the plan goes up, the subsidies that are available actually go up too. That's the dynamic that Emily was describing before.
So I know, sorry, Leslie, and then I'll get to you. So I know when we kind of went through this, I guess last year, or 2021, when it was first rolled out, there were some slides we saw where it was actually pegged to an income. That income is 8.5%. percent or?
The percentage changes based on your income, but once you get to 400%, which used to be the cliff, then 8.5 is the limit.
Okay.
Yeah, it's a much lower percentage at lower income earners.
Okay.
Are you good?
Yeah, I'm good. I just want to make sure I understand. So if I make $120,000 a year, I'm eligible for a subsidy, is that, if I'm a family of four?
I think so. I don't have the current, but probably not too much.
I think the answer is yes. If you're buying directly from the individual if you're buying through Vermont Health Connect in the individual market, people get some benefit for a fairly high income, even when they have fairly high income.
Leslie? So last year, if I remember right, you sent out to us some information for us to post on our Front Porch Forum in order to help constituents understand about that, and that was really helpful. So if it's time to do that again, any support in that arena is appreciated.
Well, you get emails from me from time to time, don't you? So yes, I'll keep doing that.
Yeah, so just appreciate it.
Those are helpful.
Yeah.
I copy and paste them right.
Yeah, right into Front Porch Forum, so.
Great. Any other questions for Mike? All right, thank you.
We often joke, it's usually Sarah and Blue Cross as well, but it's usually Sarah from MVP as well. It's usually Sarah from Blue Cross and the chamber, Betsy from the chamber that joke and say like, we're never in agreement.
Right.
So it's an odd thing when we're in agreement, but it actually has happened on a fairly regular basis on this topic.
On this topic, definitely.
So in the past, we've given each other high fives because often we're.
That is a good segue to Betsy Bishop, who is very rarely in this committee. So welcome.
Thank you. Yes, I'm going to join the nerd club of those who like talking about health insurance. It's the only time you're going to see me in here. So I think Mike mentioned that, if anybody wants to talk about it more deeply, we're available. So that's part of what you're seeing here. I'm going to take 2 minutes at the top just to introduce myself because I'm not in here. My name is Betsy Bishop. I'm the president of the Vermont Chamber of Commerce. There's about 30 chambers of commerce in this state. Many of you know your local ones. We're the statewide one. Our mission is to advance the Vermont economy, and our members are all the small businesses. Yes, there are some large businesses, but frankly, Vermont just doesn't have a lot of them, right? So, and we have them throughout the state, and our effort is to really think about how we advocate for them. And often that voice is not always heard or interested in, but if you think about the businesses in your towns, those are our members, and those small businesses are the ones that I'm here on behalf of today. About me personally, I don't even dare tell you how many years I've been in this building. Too many, some might say. But I've been advocating in a variety of ways and serving Vermonters like you have, but in unelected positions. I've been both in government in several roles and outside of government. So I feel like personally I've been working toward good policy in Vermont as well for many, many years. And some of you know that, and some of you are new, and I'm just meeting you. So that's just a little bit about me. So thank you for taking up S54. You've gotten a good tutorial from previous witnesses about what this is about. We do support the passage of S54, and it is, I wouldn't say rare, but it is not a common occurrence where you get all sides agreeing. And this really is a win-win situation for everybody. It's a win for small businesses because it protects them from having to shoulder the burden of increased costs from the individual market. It's a win for those individuals that have to buy insurance on their own because, yes, their rates go up, but they come back down because of these federal subsidies. It's a win for the state because the state is getting additional revenue from the federal government and not having to shoulder those subsidies themselves. And it's rare that we see any bill come through any committee that's a win-win-win, that everybody's like, yes, let's do it. So this is, in my opinion, an easy bill to say yes to. I think what was alluded to earlier was the root issue. This does not fix the root problem. And that is what I encourage you to think about before it's time. To try to somehow, whatever your personal system is for remembering, when you get back here next year, start to think this will bring this issue back to you. But this notion of the individual market and the small group market, we have been working on this issue since the ACA passed 10 years ago, because at that time, that was the first time that that Vermont chose to merge those markets. We were opposed to that at that point. And the reason that we were opposed to merging those markets is because when you do that, yes, the principle of more, spreading the risk around more people is what that was about. But what happened was the cost shift that businesses were already experiencing increased dramatically. And as a case in point, when we unmerged the markets in 2021 because of these subsidies, we learned exactly how much that was. Very different numbers each year because people are coming in and out. So in 2021, that number was $17 million. That's a lot of money. So if we were to not do anything in the future, the number might vary a little bit, but you could expect that when these markets become merged again, that businesses would shoulder $17 million to help the individuals. That's hard for these small businesses because when you get into the details of this and learn the definition of who can purchase in the small group market, it is not large businesses by any means. It is the small businesses. And so if you think about what we've all been through in the last couple of years with the pandemic and the plight of the small business, you know, many of them were shuttered for quite some period of time. And we're starting to see the economy rebound. Now, of course, we've got inflation coming, we've got looming recession talk and all of that. But when you look at the revenue numbers to the state of Vermont, they feel pretty healthy right now. And we're seeing some good stories coming from various businesses. We had Tourism Day last week in the State House. Many businesses were those small businesses that were shuttered, and they're starting to feel that rebound. But there's still some root problems left over from the pandemic, workforce being among them. So the struggles there continue, just like the struggles for individuals continue. So when we come back to look at this issue and try to fix that root problem, you'll see me here at this table. You will hear me arguing for the plight of the small business. I don't have the solution readily available, but just going back and merging them to create a larger pool to help the individuals in that market, you know, maybe there are other solutions. And that's something that the summer study committee that I participated in, we sort of struggled with a little bit, and starting to think ahead for you to bring some ideas to the table. But that's sort of the nutshell of what we're doing today and what we're looking ahead for a little bit. I think that's all I've got. I wanted to throw out one number for you. I think Addie mentioned that there's 70,000 people in this realm. Just to keep that in mind, that's 6% of the total health insurance pie of all the people covered. So when we're talking about this issue, we're talking about a really small percentage of the covered lives in the insurance market. So that's just you. Sometimes Diva will do a deeper dive for you and you'll see the pie and who's, you know, covered by what, Medicaid, private insurance, large group, whatever. This is a 6% slice. So keep that in mind. And then the increase that I mentioned, the 17 million, that represented a 7% decrease in small business health insurance premiums when these markets were unmerged, which was great. But the only reason we could do that is because we had those federal premium subsidies. What the federal government is going to do in the future, I refuse to predict. Sometimes when I read those federal headlines, I am so glad I'm working in Vermont, because I would not want to be down there on Capitol Hill trying to predict what they're going to do. So thank you.
And I just want to say really quick, I think the one thing to really remember, because we struggled with this when we had to make the decision what to do before we knew the subsidies were going to continue. It was kind of like, well, you're going to hurt one or the other. We just don't know. Luckily, the subsidies continued. But when you say small businesses, they are also individuals, right? Mm-hmm. So they are the employees of the small business. So it's not like we're, you know, we're all trying to help the people, the 6% of people in Vermont who buy through one of these mechanisms, so. just wanted to
Yeah,
remind you of
and
that.
in the ACA, when that passed, there was also a bunch of other changes to the small business market. I won't bore you with that, but Vermont has a lot of businesses, small businesses that are one-person businesses. We have a huge amount of them. And those are your entrepreneurs, your sole proprietors. And previous to the ACA, those were considered businesses, and they're not now. So that is exactly what you're talking about. Some of those people who are one-person businesses have to purchase in the individual market and don't get the opportunity. In the past, it wasn't really an opportunity because they were merged. Now it's unmerged, but there's a lot of details here that we don't need to talk about today, but that if we're trying to think about additional solutions. And I think when we were in the throes of will the federal government extend or won't they extend, some of the conversations that we were having were, is there some way that we could find X millions of dollars in the state budget to bring in, to provide those incentives to the individuals so that you have, again, a win-win where the businesses could survive on their own in their own group and get those lower premiums and not shoulder the burden of somebody else's costs, but find state government money to provide greater subsidies to those people. We didn't have to go too far down that path because the feds at the last minute did what we needed them to do, and so here we are. I don't know if that's a viable solution. I don't know what that number is, and my guess is that number floats, and where the money comes from and all of that, that's a much bigger discussion than for today. But.
Yeah, maybe the people that were here know the answer to this, but the subsidy, is that money taxable for that individual?
That's a good question. I don't know the answer. I would think not, because it's a calculation before you pay, I think, but that's probably above my pay grade, or some CPA needs to figure that out. Because I think what happens is it's done in the calculation and then you pay.
Yeah.
Okay.
You don't.
Because, okay, I'd love to know that.
Yeah.
It would make a difference
Right.
to those individuals.
Right, because
A tax credit is one thing,
Yes.
subsidy is another.
Yeah, it's a good point. I haven't thought about that.
we'll get that answer. I'm pretty sure that it's not taxable. 'Cause the person doesn't actually receive the money. It gets applied.
Off the top.
It's,
Yeah.
although healthcare benefits in your work are taxable.
Right, well, that's, yeah.
So,
Which is very annoying here.
well,
Any other?
we pay a lot of those things. Great. And it was nice meeting some of you who I haven't met before, so thank you.
See you next year.
You'll see us on lots of other things, housing, taxation, across, economic development.
So Lori, if I may, thank you, Claire, for posting that. It's really helpful. And there's a graph in there that I'm really struggling to understand.
Are you talking about the report?
In the report. It's very complex, but I think it sums it up. But I don't know if we want to.
Well, let's hear from Claire and then we'll see about that.
Great. Good morning. I'm Claire Buckley. I work with Leonine Public Affairs, and I'm here today on behalf of MVP. And as I'll just add to the support for this bill, which is that, MVP strongly supports S54 because as you know, it would maintain separate individual and small group markets for 2024 and 25. We believe it would fully leverage the additional premium subsidies, which would provide affordable coverage for individuals and families without employer-sponsored coverage, but it also provides the affordable and stable coverage options for small employers than if the two markets were merged, and that's what you've been hearing from this morning. MVP is actually, continuing to lobby the congressional delegation. That's not me doing that, but them, about the importance of maintaining and extending the subsidies beyond 2025. And But in the meantime, S54 will ensure the most affordable coverage options for all Vermonters that MVP serves. And the timing, I think was mentioned, is very important. It would be really great if you could move this bill and get it enacted into law. The 2024 health insurance premium rate filings are due on May 9th, 2023. So we're already putting those together because it does take some time to put them together. And so certainty around those filings it would be greatly appreciated. So we would really ask you to, hopefully it's a standalone bill. And so hopefully, it can move forward and the timing can be as quickly as possible.
Yes. We're good. We're good at that around here. Usually in this committee.
Right. And I'm happy to try to answer any of your questions or
any questions.
Take them back if I
I
don't.
just want to thank you for that date. I was just reading Sarah Teachout's testimony, which mentions the date as well. So
Yeah.
that helps me with my confusion on the timing. Good, appreciate that.
Go ahead.
That date is super important for next year too.
Yes.
It's the same date.
Yeah,
So.
24, 25.
Right.
More complex next year, start early.
Right.
Yeah. So, and that.
Any other questions for Claire? Great.
Thank you.
And Leslie mentioned it that we have Blue Cross Blue Shield, Sarah Teachout sent a written testimony. She apologized she couldn't be here today, but they are in support as well. So any committee discussion on this? Thoughts, comments, concerns? My intent is to pass it out this week unless there's concerns, but I'm not expecting to take additional testimony. I think we heard from everyone. Art?
Well, I just want to, Alyssa asked the question, but we kind of got an answer as to the amount saved by the small businesses, 7%.
Yeah.
That's significant.
It is.
And so it looks like what we did worked,
Yes.
which, you got the subsidies, it worked.
Right. Keep going, right? As long as we have them.
Seemed to me.
Yeah. Agreed.
Seemed to me.
Yeah, I'm okay, but I want to make sure that people aren't paying taxes on that subsidy.
Yes, we will verify that before we leave here
I
today.
got to do some calculating after that.
I also want to reiterate your point, which is a lot of people on the exchange, individual exchange, are small businesses.
Yes. Yeah.
And not just small businesses of one.
Right. Right. I mean, we say small businesses, but we're talking about Vermonters at the end of the day. So.
I just got a question because this is all new to me.
Yeah.
We talk about individuals and we say there's a lot of money left on the table. Okay. So when these people get onto the programs, they've also got to make a decision what's the best insurance plan for themselves,
Yes.
right?
Yes.
So it isn't just switch and save a few dollars.
Well, except that, so if you're buying direct through Blue Cross Blue Shield or MVP today as an individual, they have the options of several different types of qualified health plans: bronze, silver, gold, platinum, maybe. If they are buying one of those, right? So if I was buying one of those, I could go to Vermont Health Connect, buy the same exact plan, and see if I would get subsidies. And so you don't even have to switch. So you can go on Vermont Health Connect, and I know this because I just did it because I left my job. This is the process. So you go on to Vermont Health Connect and you fill out kind of a questionnaire of how many people, how healthy you are. And it says, do you want to see if you would receive premiums, or however they phrase it? And you check a box and it's going to do some calculations for you. And it'll say, your premium is this, but you receive subsidies of this, so you're going to pay this on a monthly basis. That's your premium. Then you can choose what to do. And I will say, I was probably on the website for 2 hours, just like looking at different plans, because I had never bought direct from the carriers. I had an employer-sponsored plan. But to be clear, if you're buying direct, go do this and see if you can save money for the next year or two. And there's no open enrollment issue, so you could switch tomorrow, and I think it takes effect like the first of the next month or something like that. So it's important.
Yep, thank you.
Yeah.
I've also navigated some of this as a farmer and a small business and an individual family. And I would find that the Vermont Health Connect too, if the website is daunting, working with individuals on the call center have been super helpful.
Right.
And walking through the options and then like spelling it out. And with farms, income can often change based on how well your crops do. And you have to like adjust that. And so going through that process, I found on the call was really helpful. So a barrier seemed to be taken down because I am not fluent in this yet. I'm getting better today. But, I just put that anecdotally out there.
That's good to know.
Yep.
To start answering Topper's question, I just Googled and healthinsurance.org says if I get Obamacare subsidy in the exchange, is the subsidy amount considered income? No. The subsidies, both premium and assistance tax credit and cost sharing are not considered income and are not taxed. I'm sure we could get the official.
I'll reach out to Addie, but that's helpful.
Yeah, so at least it's a start.
Do we know anyone who doesn't support this bill?
No one that we have talked to, and it was obviously on the Senate side, and they didn't hear anyone that doesn't support it. I don't know if you have.
And it's been going on for 2 years now, and even through that whole process.
Yeah, we did it twice.
No, that's an odd question, but.
No, it's a good question.
It's totally unusual in this building, right?
Something has to be wrong.
Trust us, we're all
And I will say that's one of the reasons that I try hard to put something on an agenda and give it a day or two before we vote on it. So that if people are paying attention and they don't like something, they can reach out to us. So although I think we could take a vote today, we won't. Just 24 hours, give it some time. Art?
You just said something, Alyssa, that makes me wonder. You said that small business owners are on the individual markets. Explain that to me. Okay, so I own a business and I pay my business insurance to the small business piece of this. And then, but me personally, I'm on the individual.
So if a small business doesn't offer health insurance to their employees for lots of different reasons, then if there are individuals within that business that need to have insurance, they will go on the exchange and purchase.
All right, gotcha.
On the individual exchange.
Gotcha. So, and this will be only for the small business that offer a policy.
Like our small business, we don't offer health insurance. If we wanted to, we would buy that way. But now we just say, you go on
your own. Got it. Yeah.
Any other questions? All right, so right now the plan is to vote on this on Friday, which would require us to come in at 9 a.m. If there are no objections, I will squeeze it in tomorrow morning during testimony. Does that work for everyone? And then you all can sleep in on Friday morning? Okay, so I'll find a time for that. So great. Let's take a half an hour break. And I suggest people get outside.